Just about 7:30 now. Thank you for joining us. We are talking about mental health and the holidays, and really this could be mental health 365 days a year. I have Adrienne Hlavati with me and Brianna Velazquez from the Mental Health Cooperative joining me, and really appreciate your wisdom on this issue. We also have many numbers to give out, and we're going to pop up this screen that has a lot of numbers, and I ask people to get their pens and papers ready because these are important numbers to either have written down or on your phone. And Adrienne, if you would talk some of these numbers through with me and tell me exactly what people will find if they call. Let's first start with the Tennessee Statewide Crisis Line. Who should call that?
Yeah, sure. Absolutely. So that can be anywhere in the state. So that can be outside of Davidson County, and they can do transfers to other places or direct you to the right place if that's not the actual place for you, right place for you to call into. Okay. They can transfer you to us or other local mental health agencies.
Gotcha. Then we have the Crisis Talk Line. What is that?
So that is like a talk, just strictly a talk line. That's what that is for. If you're having issues, want to talk through situations and just have that extra level of support, that's what that line is for. Is
that a free service? Is there a charge with that? It is free?
No,
wow.
There is no charge. It's absolutely free.
And then is the text line very similar?
Yes, so that's something some people that aren't comfortable with talking, they can text instead.
Okay. Then we have the Suicide Prevention Lifeline.
Yeah, so that's exactly what it sounds like. People that are fearful, upset, concerned, and need to reach out, they can start with that.
Yeah. Then we have the line for the Mental Health Cooperative to reach you all. And when would this be appropriate?
Yes, that is our 24. I'm sorry to interrupt. That's our 24-hour number. Yes, so they can call that number any time of day, any kind of crisis. And if they're not sure who to call, they can call us and we can redirect them if we're not the appropriate place, do warm transfers to other agencies. So that number can be used for anything.
Gotcha. And then what is Centerstone?
So Centerstone will have, they do have a location in Nashville, but then they also have resources in surrounding areas as well.
Okay. And then we have Psychology Today there, the website, which is psychologytoday.com, and also it looks like, I'm trying to read them from far away, centraltn.com. Tell me about those websites.
Yes, absolutely. So more for Kid Central, more resources for children, and we can also provide resources for children as well, but the KidCentralTN.com is specifically for kids.
And that's a great jumping off point. I do want to kind of transition into talking about children specifically and the mental health struggles brought on by the pandemic. For many children, this is their third year in school dealing with the pandemic, and there has been so much back and forth on different restrictions in schools and whether they're in school or out of school or homeschooling or virtual schooling. And that's just one part of the pandemic they've had to deal with. Children are struggling. Some of the numbers are just astounding when you look at admissions into psychiatric hospitals or the need for treatment that is going unanswered. It really is heartbreaking. What are you all seeing?
Yeah. So I think with kids, kids seem to be particularly affected by isolation, changes in routine the last 2 years. And I would say definitely may likely be in need of extra support because that standard that they would have expected from school and just that normality isn't there. And research does show that in school is where kids are connected to the treatment that they need a lot because they have the teachers there, they have school counselors there. And so typically that's where our kids are getting connected to the help that they need, and they do have those support people that are able to see and identify, oh, okay, you need some help and you're talking to me because you feel safe to do so. And so I think not being in school, not only can things be undetected because of that lack of support, but then there's the overall lack of socialization, and that's difficult and very challenging. And so it's hard for adults, hard for kids.
Any warning signs that parents should be looking out for with their children, whether they be young or in the teenage years?
I think more withdrawal, more isolating than you would normally see. Probably poor attention to schoolwork. I mean, that's kind of a tough one because virtual school is really challenging for people.
Yes.
So that's going to be a tougher one. But more acting out, more anger. Things along those lines that really just seem very different. And I think kind of like what Bree spoke to earlier, of really continuing to have those open conversations with your kids and really providing that forum for them to be able to talk about feelings and talk about what they're going through. I've said to many people, being a child, a teenager right now would be so challenging with social media and with all the things that kids have at their fingertips. So you have that already as the base. And then on top of that, all the challenges that they're facing with the pandemic. And like you mentioned, the virtual school and the back and forth of going to school for a while, then having to go back home. And they really are absolutely struggling.
Yeah, and not to mention their bodies are growing and changing and hormones and all the things of discovery. Yes. And here we are, with children who are just struggling. We did a story on the news side of things just a few weeks ago about how there are just not enough services for children in Tennessee. That has to make it hard to make referrals.
Yes. Yeah.
Absolutely. We see that all the time because that opens the door for me to discuss a little bit further with our treatment side and our 24-hour walk-in center. We don't, unfortunately, have the treatment services that we offer for adults for children. And you're absolutely right. For kids that are in a psychiatric crisis, really the options are to go back home with parents or whomever their caregiver or guardian is, or go to the hospital. And there are not enough psychiatric beds for children and youth. So it's just this vicious cycle that's been really challenging to break. We do have a very strong outpatient services at Mental Health Cooperative for children. So that is an option when a child is in a psychiatric crisis, that they can have that level of support. We do offer the outpatient side for children and youth.
I wonder if parent counseling is also needed when a child is going through crisis.
Yeah, I definitely would not discount all levels of support being necessary, because all ends of the family are being impacted, and as a parent, it's going to be challenging and tough to see your child struggling, as well as maybe you having some of your own things that you need to work through. So I think support on all ends, very important. Yeah.
I do want to switch gears just a little bit now and first of all remind people that this is OpenLine. You are welcome to call whether you have a question on resources or something specific you would like to ask about and get some advice about. Now's your chance. The lines are open, 615-737+. We invite you to call in and get some help. I do want to talk about what many across many industries are calling the Great Resignation. People are leaving their jobs in record numbers right now because of burnout, because of the pandemic. They have said, I'm not doing this. And people are just struggling with making these big shifts in their life. What are you seeing from the counseling side on this? What are you hearing from people?
Yeah, well, I would say definitely we're seeing that, we're hearing about it. And you're absolutely correct. There is a big shift in life, and there are a lot of big adjustments that people have had to make with COVID-19 and all of everything from that. And so I think you're seeing people who things have been turned upside down and out of their control, and perhaps their choice to where they're working or whatever it may be, that may be something that is within their control to make. And so and I think everybody's life has been really shaken up. So people have had the time to reflect and look and see what are the choices that I want to make for me, and maybe now is the time for me to make a big different choice.
What would be your advice to somebody who just really feels burned out in their career right now? What should they do? What do they need to take stock of before they make one of these life-altering changes?
Yeah, I think being very mindful of what are your needs, and being able to identify what is it that I need. Is what I need some time off? Do I have the capability to do that? and take a step back? Do I have the option to talk within whatever job role that I have with my team about maybe changing job duties or whatever that may be, and starting that conversation? But then also, if possible, taking time to lean into, if you have support to talk through some of those big changes. I think that's always valuable if you have somebody to bounce some thoughts or ideas off of, and you have that support. But also to keep in mind, if you're feeling overwhelmed, that this may be a good time to begin to seek some additional support. And that may look like some counseling, that may look like leaning into that branch of having your own space to process through things, your own space to talk with a mental health professional. And so that could be a good opportunity to begin that layer of support. And I would encourage that.
And along those lines, as I think people become more comfortable a little bit with seeking help, as we talked about earlier, if you get over that threshold of like, okay, I'm going to make the call and seek help, and then you land with something that you are just not jiving with, is that normal? What should you do? What can you expect?
Absolutely. Yeah, that's very normal. I think finding whether that be an outpatient therapist or something like that is oftentimes like finding a friend. Sometimes there may be some really great people out there for you, and really great people, but they may just not be your best fit. And that's okay. And it's completely normal too, to say, okay, I want help, and to take the time to evaluate, is this the best fit for me? And that can be a challenge, especially when you're first reaching out, but it is absolutely necessary because you want to have the support that is the best fit for you, and you're deserving of that.
I do want to go back to the lines. We have another caller waiting ever so patiently. Nicholas is on the line. Hi, Nicholas.
Hey, how you doing tonight?
Hi, I'm good. How are you?
I'm good.
Go ahead.
And this is for everybody. We've seen, and personally myself, I've seen during the pandemic, it's even more so since the George Floyd incident, people's lives have gone completely haywire in unexpected ways. When people who hoped to rebuild in the summer 2020, let alone 2021, were unable to. And what would you recommend the process for somebody who wants to try to rebuild during the holiday season, and more particularly for 2022?
Yeah, that's a great question. Gosh, it seems like this whole pandemic has just dragged on, and just when we're thinking we're coming out of it, it's like wham, we're right back into it. And there's so much uncertainty about what's next. Are things going to normalize, or is this the new normal? Adrienne, you want to take a stab at this one?
Yeah, sure. I think I appreciate the question as well. And I think first kind of trying to determine, when you said wanting to rebuild, I think that's a wonderful thing to look at. And what are the things you want to start with in terms of your foundation so that you get to the place that you want to be. And I think also accepting that it may be where you were before. It may look really different this time. And how does that look? And then Bree has pointed out several times about reaching out to other levels of support. Who do you have in your life that can help you with that rebuild? Or do you need to reach out and get professional help and have someone else that you can talk to that can help be objective and really look at your life and help you with the goals that you have? But also being patient with yourself and understanding that it might take some time, and that it's okay if you stumble along the way, but just continuing to have your eye on those goals and the things that you want to accomplish.
And I think Nicholas, he said something that brought several things to mind for me, and that he mentioned the social unrest, and I have noticed throughout the past year and a half, people struggle with different things, whether it's specifically COVID or it's the social unrest that we have gone through in this racial awakening that we have experienced, whether it's the death of a loved one and grief, or it's the job and the burnout. There seem to be so many different pots boiling right now for different people, and yet we're all collectively dealing with it together. Do you all see that?
Absolutely.
Yeah.
Oh,
Absolutely. And I think it's finding some of that camaraderie with other people that are going through similar things. And we find that so much in our treatment side of our agency and having groups and being able for people to relate to one another and be able to share that experience. And shared experience helps so much because I can talk to you, all day long about what you're going through, but having someone that can actually relate to you oftentimes is really sometimes that missing piece. So I think you're absolutely right that we have so many areas of civil unrest and in the pandemic and just all of the things that are affecting our world right now. And how do we even find silver linings? What kind of small things can we even look at that are actually positive that we can try to keep our eye on?
Yes, absolutely. Okay, we have to sneak in another quick break here. When we come back, more of your questions. Stay with us.